some drug categories in the gastrointestinal system. So some surgical procedures that can be done on the stomach and intestines, a bowel resection and anastomosis. So remember last time we said anastomosis is like a fancy medical term that means to cut or to sew two ends of a tube back together. So we see this if you happen to have like a part of the small intestine removed, you'll cut a piece out and you'll anastomose or sort of sew it back together. You can have an anastomosis of blood vessels. If somebody has a vasectomy and their vas deferens is cut and then they want to reverse it, they would have an anastomosis of the vas deferens. So that term anastomosis, maybe you make a separate flashcard for it so you know that it means reconnecting of two ends of a tube. All right. So a bowel resection is to resect is to cut out a part of. So if you had like an inflammatory bowel disease and a section of the intestines was badly inflamed, or if there was cancer or something else that required you to cut out a portion and then anastomose it back together. Gastroplasty is a procedure to reshape the stomach. Plasty means to reshape, so pretty much all types of plastic surgeries will end in plasty. And the last chapter, in the chapter 13 about the female reproductive system, we'll talk about mammoplasty, procedures to reshape the breasts. Yep. So gastroplasty, there's lots of different types of gastroplastic procedures. They reshape the stomach, essentially make it smaller. So that's what bariatric surgery is. It's making the stomach smaller through gastroplasty. Stomach stapling or having part of the stomach removed. Or gastric bypass is another popular one where they cut out most of the stomach but leave it in there so that in case you want to have it reversed, you can. Some other surgical procedures. These are all different types of ostomies. They have that suffix stomy, which means a surgically created opening or hole. So I'm like indicating my neck. We'll talk in the next chapter about tracheostomies. But in the gastrointestinal systems, there are surgically created holes in parts of the intestines that allow you, for example, a gastrostomy is an opening in the stomach that allows you to feed people externally through like a G-tube is what it's called. There's a gastro tube that you can feed like liquid food directly into the stomach without a patient having to swallow it. So this might be done if a patient has dysphagia, painful or difficulty eating or swallowing, but they still need to get food into their bellies. It's also fairly common in picky toddlers who don't eat well, and it's really hard to get them to eat. You can give them a G-tube, and you can feed them through an external bag. Colostomy, jejunostomy, these can also be done in the case of like if you had to have a part of your bowel resected or removed due to cancer or something, and you didn't have enough peristalsis in that organ anymore to defecate properly. You might have a colostomy bag to collect feces that are formed. These can be temporary additions or temporary surgical procedures until peristalsis is restored, or it might be permanent if you have permanently sustained damage. Some other medical surgical procedures, an exploratory laparotomy. This is a common procedure. It's not really pertaining necessarily to the gastrointestinal system. It pertains to any organs in the abdominopelvic cavity. If a doctor can't diagnose a problem with information from non-invasive diagnostic tools like X-ray or CT scan or other radiographic procedures, they might want to actually get inside and use their eyes to look around inside. So that's an exploratory laparotomy. They make an incision in the the abdomen, and they explore. Also, surgeries when you're actually having a surgery done to remove an organ, it can be done what we say laparoscopically, where they make small incisions in the abdomen, and then they can stick in various tools like a lighted scope, saline or something like that, and they're surgical tools. So they don't have to do a full cut across the abdomen. They can just do smaller cuts. So those are called laparoscopic surgeries, where they do these very small incisions. It is less traumatic and much faster recovery and less risk involved. So a lot of surgeries, hysterectomies, gallbladder removal, appendix removal, all of those can be done laparoscopically. A biopsy is a medical procedure, again, that's not necessarily specific to the gastrointestinal system. It can be done for any type of body tissue. It's basically taking a cut of live tissue, that's where the bio comes from, and opsy means to look at. So it's looking at live tissue, usually to look for signs of cancer or abnormal cells. A nasogastric tube is another way to feed patients who can't eat. This is usually just used in the hospital setting, whereas a G-tube is more permanent for that patients can take home with them. A nasogastric tube goes up through the nasal cavity and down the pharynx and through the esophagus. So there's a tube that leads all the way into the stomach. So again, like pureed, liquefied food can be delivered to the stomach without having to eat, per se. Some various procedures to view inside the gastrointestinal tract, different types of oscopies, scopy, procedures to view. Esophagoscopy would be to go down the esophagus. Gastroscopy, go down and look inside the stomach. So the top three would send a scope, an endoscope, through the mouth and down the intestines that way. Whereas a sigmoidoscopy, the sigmoid colon, a colonoscopy can look at various parts of the colon. Those would go up through the anus. You'd have a colonoscope that goes through the colon to view the lower parts of the gastrointestinal tract. Okay? The scope being the tool, an endoscope being a tool that's used. These are different types of ectomies, surgeries to remove something, to remove part of the gastrointestinal system, part of or all of the stomach, to remove hemorrhoids, to remove the appendix. What about this one? Gallbladder, cholecystectomy, remove the gallbladder. Polypectomy? To remove polyps, yeah. Some other ones. A herniorrhaphy. Here's that spelling pattern again, RRH, okay? That suffix raphy means a procedure to suture. So if you have a tear that needs stitches or suturing, you have a raphy procedure. So a herniorrhaphy, you have a hernia, you have a tear in the abdominal wall. So you need a herniorrhaphy to suture it back together. Liver transplantation, if you have liver failure, you can get a new one from a donor, and that's transplantation, getting one organ from one person to another. And then the last part of the chapter there's a page or two about different drug categories. And it's pretty detailed, and it gives you lots of different drug categories, and it tells you the specific drugs that fall under that category and what the action is. Don't focus too much on that section in the book. Focus on the slide that I have in my lecture notes, because I really am very picky. I only pick a few of those drug categories, namely the ones that use medical terminology, that you could decode using your medical terminology skills. Okay? So, antacid, what is that used to treat? Heartburn, or reflux, what's the acronym? GERD, yeah, exactly, GERD, GERD. So it's an anti-acid, and those are conditions that are caused by acids. It could also be used to treat peptic ulcer, to treat the symptoms of peptic ulcer, to reduce pain. Antibiotics would be to treat bacterial infections, living things, bio, and it's antibio, so it's anti those living organisms that cause disease. Antidiarrheal is to treat diarrhea. Antiemetic would treat nausea and vomiting. Emetic means vomiting. Laxatives, you can't tell from the medical word, but it treats constipation. It's a very common class of drugs, so you should know what a laxative treats. It treats constipation. Okay, so that is the end of Chapter 3. Now on to Chapter 4, which is the respiratory system, which has significantly fewer parts. The gastrointestinal system and skin are probably the two longest chapters. They have the most parts. And then also a lot of diseases that go along with those parts. All right, let's get this set up. Okay, so Chapter 4, Pulmonology, the study of the respiratory system. So pulmono is a combining form, you should know. I think it was in Chapter 1 or 2 anyway. So it means lungs. And respiratory is actually, I think a lot of people think of it as more of like an English word that's in use, but it's a medical term that comes from Greek and Latin roots. Re means again and again, and spiro means to breathe. So respiration literally means to breathe again and again, which is what you do when you respire. You breathe in, breathe out, over and over again. So I have a term of the day for this chapter, and it is Ondine's disease or Ondine's curse. And it's one of those rare eponyms that is not named after the doctor or, medical professional who first described the disease. It's actually named after a Greek myth. Let's down a little bit. So Ondine was a mythological character. She was a water nymph. And of course she fell in love with a mortal, with a human man. And they were madly in love, and he swore to her that he would love her with every dying breath or something like that. And then, of course, he cheats on her, and she finds out, and she's pissed. So she curses him, and she says, "You promised to love me." Or no, he said, "I'll love you with every waking breath." And so she says, "Screw you, you're cheating on me. So you promised to love me with every waking breath, so that means when you're asleep, you don't love me. So next time you fall asleep, you're going to not wake up again." And so that's what happened. So she cursed him. He tried to stay awake so that he could love her, but then he fell asleep and he died. So in this condition, this medical condition, which the medical term for it is congenital central hypoventilation syndrome, which is a mouthful, but we can break that down. Congenital means born with. Hypoventilation.
You're not breathing enough?
Yeah, not breathing enough, not moving air below normal, hypo. Central refers to the brain, the central control center of your breathing rates, and syndrome, a collection. It's a collection of symptoms. So what happens in this? People are born with it. Really, babies. Babies are born with it, and there's a problem in the central control regions that control breathing, and they're not breathing enough. Mainly when they're asleep. So what happens is babies who have this condition, they fall asleep, and that portion of their brain that regulates breathing when they're sleeping stops functioning. And they basically stop breathing. It's like a really severe form of sleep apnea. Most of the time sleep apnea is caused by, blockages or something in the throat. This is a problem with the wiring in the brain, and that the brain actually turns off too much. It's more common in premature infants or very young infants, and it's thought to be a cause of SIDS, a sometimes cause of SIDS, sudden infant death syndrome. So if you're reading the bonus book, Cutting for Stone, there's a case of this in there. And basically you have to be able to catch it happening and poke the kid and make sure, or now if a kid is diagnosed with it, they can have some kind of sensor or monitor on that shakes them or when they stop breathing. But their brain just literally stops functioning just enough to stop breathing while they're sleeping. So it's a very serious form of sleep apnea, named after this mythological curse where the man goes to sleep and doesn't wake up.
So, during normal sleep apnea, though, you can get the machines that help you.
They help to pump oxygen in, so that, because in normal sleep apnea, your brain doesn't forget to breathe.
Yeah.
So you're not really at risk of necessarily dying from it, but you are at risk of having these oxygen fluctuations. So the breathing machines help restore your oxygen.
But they don't use this for this?
They might use those machines for that. I don't know if they have them for small infants, but they might actually use that. That's a great question. Okay, so this is the picture of the respiratory system and all the different parts of it. So it starts in the nose. You take air in through the nose and through the mouth, which is why the nasal cavity and the pharynx sort of meet together. Air goes down the back of the throat, the pharynx, and then down the front pipe here, your windpipe or your trachea. The larynx, your voice box, is also part of the respiratory system. You make sound through breathing, through movement of air through the larynx. So air gets carried down the trachea, and the trachea branches into these two arms called bronchi, which is plural. Bronchus is singular. And then those bronchi go into the lung tissue. They branch off into these smaller branches and ultimately into air sacs. But those are all covered by this lung tissue, which keeps them nice and protected. So you have a right lung and a left lung. Notice, this is a good slide to point out, that the right lung is a little bit larger than the left lung and has actually more lobes. There's 3 lobes in the right lung, only 2 lobes in the left lung. Why do you think they're shaped like that?
Because the heart's
The
on the
stomach,
left
I
side.
don't
Because of the heart. The stomach is also over here, but it's really the heart that's in the thoracic cavity. The stomach is a little bit lower in the abdominal cavity, but the heart, exactly, the mediastinum is right here. So to make room for that, the left lung is a little bit smaller, compensates for that. The respiratory system can be divided into the upper and lower respiratory tract. The upper respiratory tract is everything in your head, and the lower is everything in your neck down. So if you had a head cold, like congestion or like an ear infection, or like, I don't know, if ear infection is, I guess, more of the ear canal. But if you had like a nose infection, that would be called an upper respiratory tract infection. So we'll see that later. A URI is a common term for an upper respiratory infection. If you have laryngitis or bronchitis, inflammation in the larynx or the bronchus, then you'd have a lower respiratory tract infection. Those are commonly used terms. So a little bit about some terms that indicate breathing. So of course we breathe in and we breathe out, and we do that repeatedly. Breathing in can be called inhalation or inspiration. Halo and spiro are both combining forms that mean to breathe. Likewise, breathing out is called expiration or exhalation, again, using those same combining forms. Everyone has a normal breathing rate. You guys all sitting here relaxing are probably breathing at a very normal rate. If you start working out, your breathing rate increases. Or if you're stressed or if you're hyperventilating, there's lots of things that can cause you to have an unnormal breathing rate. So if your breathing rate is normal, you would say that you are eupneic, that you are experiencing eupnea, a normal breathing rate. So this might be indicated on a medical chart to indicate that even though a patient is suffering, certain symptoms, that their breathing rate is normal. They have eupnea, okay? Meaning good breathing. Latifah, do you mind shutting the door? Thanks. A little noise pollution out there. The first part of the respiratory system is the nasal cavity. All right, so you breathe air in through the nose, and the nose has a lot of purpose, actually. It's sort of the entryway for air from outside the body, and it has sort of like the bouncer of the respiratory system. So there's these structures inside the nose called the turbinates, and the mucosa in the nose, the nasal mucosa, the mucus secreting membranes, they secrete all this mucus. So the mucus helps to trap any dirt or other particulates that are in the air you're breathing in so that they don't get into the lungs and cause infection there. Also, so that's one of the purposes of spinning the air around these turbinates. It helps trap dust in the mucus. It also helps to warm the air a little bit before it gets down into your core where it could cool your body temperature. When you go outside and it's 10 degrees, sometimes you might, when you breathe in air, it kind of freezes you, you feel like your boogers freezing a little bit, right? But it doesn't usually feel like cold inside your chest because your nose is doing that job of warming up that air before it gets inside you. So it helps you to actually keep your core temperature the same without breathing in cold air. So this back part of the nasal cavity where it meets the throat is called the nasopharynx. It's where when you have postnasal drip and you have a lot of mucus in your nose and you can feel it dripping down your throat, because it moved to the back of the nasal cavity and starts dripping down the pharynx, nasopharynx. It's how upper respiratory tract infections can become lower respiratory tract infections. So here's a better picture to show you. So the nasopharynx is right up here, the nasal part of the pharynx, and then you have the pharynx, the throat. The oropharynx is another term for this part, where it meets the mouth. And then air is going to go down this tube here into the larynx and the windpipe. It can, to some extent, go down the esophagus, especially when you swallow. There's sphincters to help the air stay out of the esophagus. There's an upper esophageal sphincter, so air that you breathe in when you're not swallowing usually just goes down the trachea. But you can swallow air. So after it goes down the trachea, here's the trachea here. Notice the trachea looks very bony in this picture. It's actually covered in cartilage, and you can feel it. If you feel the front of your throat, you can feel like the trachea is kind of ribbed because it's completely covered in cartilage to keep it, protected from collapsing. And the bronchi as well, these two branches here, are also covered in cartilage. But then they enter the lung tissue, and the lung tissue is there to protect the bronchioles, which are these smaller branches coming off the bronchi, So notice how they are not looking kind of bony. They're not covered in cartilage. They are instead covered in this pink stuff, which is smooth muscle, which is involved in contracting or relaxing them and controlling your breathing rate. At the end of the bronchioles, bronchiole, by the way, is just a word that means a small branch. A bronchus is a branch. Bronchiole, that suffix ole, just means a small thing, so it's a smaller branch. And at the very end of those, you have these air sacs called the alveoli. All right? Alveoli are the air sacs. This is where gas exchange occurs. By gas exchange, I mean this is where oxygen from the air in our lungs is taken into our bloodstream, and carbon dioxide waste is put back into the alveoli, and we breathe it out. So that exchange of oxygen and carbon dioxide happens specifically here in these air sacs, the alveoli. So as air moves down the trachea and the bronchi, there's also a mucous membrane there that secretes mucus to trap particles that shouldn't get in. You really don't want to get into the lungs. And in order to make sure that those trapped particles don't just sit there and hang out and grow, we have this sort of constant flow of moving mucus up and out of the respiratory system. All of the cells lining the trachea and the bronchi have these little eyelashes looking things. They're called cilia. They're like little hairs that move, that are constantly waving and moving mucus up the respiratory tract. So normally you're not producing enough mucus to really notice this. What happens to it, by the way? You probably don't notice this. When normal mucus comes up the respiratory tract, where do you think it goes? Your throat, you swallow it. You just don't even really notice it. And when you have like an infection and you're coughing up large amounts, then you might notice it. You might actually spit it out. But it's always just kind of a little bit's coming up and going down your esophagus when you swallow, and you're not even really noticing it. But it keeps all those particulates from hanging out in the lungs and causing infections. Okay? So this is just another similar picture showing you, this is actually where I was going to show you the right and left sides of the lung. The right side, the patient's right side, right, has 3 lobes. You can see them more clearly in this picture. And you can see the outline of the 2 lobes of the left lung. Another term, a vocabulary term for you that I'll point out on this slide is this one here, hilum. All right? The hilum is right here. Hilum is a term that basically means an indentation in an organ where tubes enter or exit it. So where the bronchus enters the lung tissue is called the hilum. There's an indentation there. We'll also see that the kidneys have a hilum. Several tubes enter and exit the kidney, and there's like a little indentation where that happens. So that's what a hilum is. It's right here. Other parts of the lung. The top of the lung here, this pointed part, is called the apex, the tip, or the apex of the lung. The bottom part is the base of the lung.
What's the part of the right lung that's not in the left lung?
I guess it would be the middle lobe. I don't know that it's just the amount of tissue. And there's more tissue in the right lung, so it's divided into 3 lobes. So it has a top, middle, and lower, whereas the right just has a top and a lower. So I guess you could say the middle lobe is missing, but the top lobe is a little bit bigger to compensate for that, I guess. So another term for you to know, like a vocabulary term, is parenchyma. Parenchyma is a term that refers to the functional part of a tissue. So you have your whole respiratory system. All right, you've got the trachea, you've got the bronchi, the lung tissue, and those little air sacs, the alveoli. Well, the whole purpose of the respiratory system is for gas exchange, to bring oxygen in and to take carbon dioxide out of your body. That's the whole point of all of those parts. And pretty much that job alone is done by the alveoli. And the rest of that system is just there to bring air in and out. The lung tissue is there to protect those alveoli. But the alveoli are really the part that does the whole function of the respiratory system. So when you have a unit of tissue like that, you call it it's called the parenchyma. So the alveoli, we would say, are the parenchyma of the respiratory system. They are the workhorses. They are the point of the respiratory system. Okay? So the lungs, of course, are contained in the thoracic cavity. Thoracic meaning chest, the chest cavity. The thoracic cavity is not just like a dry cave, all right? A common theme that we'll see throughout the course is that all of our body cavities are filled with fluid. The abdomen, the abdominopelvic cavity, was contained with a membrane called the peritoneum, and there's peritoneal fluid that our intestines kind of float around in, okay? Same thing with the thoracic cavity. So you can see here's this pink thing is the lungs, and then you've got this blue fluid. That's thoracic, the pleural fluid is what it's called, because the membranes that line the thoracic cavity fill with fluid, and those membranes are called the pleural membranes. So there's two of them. There's one that sort of lines the outside of the lung tissue. The lung is an organ, and organs are sometimes known as viscera. So it's called the visceral membrane. And then the second pleural membrane is called the parietal membrane. Parietal just means the wall of a cavity. So the parietal membrane lines the outer wall of the thoracic cavity. The visceral membrane lines the organ in it, which is the lung. And between those two membranes, those membranes produce a fluid called the pleural fluid. And the pleural fluid has a really nice cushioning effect for the lungs. Because think about it, when you breathe, your lungs expand and contract. They expand and contract. And right outside your lungs, protecting them from any trauma, are the rib cage, these bones. All right? Imagine if your lungs were always like chafing up against the bones every time you breathe in and out. I mean, think about like your feet inside shoes. Like you walk around in shoes and there's constant chafing and it causes like irritation. So in order to prevent irritation of the lungs by chafing against the ribs, you've got this nice little fluid cushion there, okay? Which is a good thing. Sometimes you have conditions where there's air in this pleural fluid, where there's too much or too little pleural fluid, and that can be a problem. So you want the right amount in there so that it acts as a cushion and not as a smothering of the lungs. But we'll get to some of those. So here's just sort of showing you some other tissues in that area. Here's the ribs, the bony ribs. And then there's muscles in between your ribs. They're called the intercostal muscles. They're between the ribs. And they're also involved in helping you breathe, helping your chest expand and contract when you breathe. The other muscle that's very important for helping you breathe is the diaphragm. It's a big sheet-like muscle underneath the lungs that helps you to expand and contract your lungs. Absolutely. So the process of breathing, of respiration, of taking in oxygen, bringing it to your cells, and then taking out carbon dioxide, it happens in 5 steps. It's divided into 5 steps. So this is just like the basic physiology of how the respiratory system works. The first step is called ventilation. That's actually the process of taking in air. You're ventilating. You're breathing in. Okay? Or in the reverse, you're breathing out. External respiration is the process of taking oxygen from the external air, which is inside your lungs, into your blood. Okay, so that happens in the alveoli, where oxygen goes from the alveoli, from the lungs, into the blood. Then you have gas transport, which is taking that oxygen to the different tissues that need it. And then you get internal respiration. Oxygen is taken up from the blood into the cells that need the oxygen to undergo metabolism. And then cellular respiration is actually the cells using that oxygen to function, to make energy, to fuel chemical reactions, etc. So you need to get oxygen to your cells in order for them to survive. If you are oxygen deprived, you can't get this. You can't have cellular respiration, and ultimately all of these things break down. So the reverse is true for getting rid of carbon dioxide. With carbon dioxide is produced by cellular respiration. Metabolizing oxygen causes the production of carbon dioxide, so it goes from the cells into the blood. Then it goes from the blood, gets carried to the lungs, where it's traded from the blood into the alveoli, and you ventilate by breathing it out. So it's this circle. Okay? So this is just a slide showing you how the alveoli, those air sacs, they have the little grape clusters at the end of the bronchioles, they're actually covered, they're wrapped in capillaries. because it's so important for gas exchange to occur here, you can see oxygen from inside the air sacs moving into the capillaries, the blood vessels, and then carbon dioxide that's in the blood vessels moves into the alveoli, and you breathe it out. Okay, so this whole process is called external respiration or gas exchange. Okay? So now for some diseases and conditions that affect the respiratory system. Asthma is a autoimmune condition, actually. It's thought now to be an autoimmune condition that's caused by excessive inflammation in the bronchioles. Your immune system attacks your bronchi and your bronchioles for some reason. So it's also known as reactive airway disease, that there's like an overreaction in your airways. So some of the signs of asthma, one is excessive mucus production and inflammation of the lining of the bronchioles. So here's a normal bronchiole. All right, it's nice pink tissue, got some smooth muscle, nice wide open lumen. But in someone who has asthma, this tissue here is clearly inflamed. It's very red. It's thickened, okay, from constant inflammation and attack by the immune system. It also produces excess mucus, which can make it harder to breathe. But the other thing that you'll notice during an asthma attack, what happens is this smooth muscle, which is normally relaxed and allowing for a nice open lumen for air to flow through, during an asthmatic reaction, those smooth muscles contract, and we call this bronchospasm. They're constricting, and they're basically cutting off airflow. They're really reducing or squeezing that lumen. So that's why people who are having an asthma attack are like, they can't breathe because they can't get air into their bronchioles because they're basically being, strangulated from within. Their bronchioles are being constricted. Some other conditions, sort of inflammatory conditions, laryngitis, bronchitis, are both types of itises, inflammation or infection of the voice box. So if you ever get sick and you lose your voice, that's laryngitis. Inflammation of the larynx will cause you to lose your voice. Bronchitis, usually when you have a chest cold, a lot of people will say, I have a chest cold, a lot of mucus in your chest that you're coughing up. That would be bronchitis, inflammation of the bronchi in your chest. So you get a lot of mucus or sputum production. An upper respiratory tract infection, or an URI, is when you have a lot of people will describe it as a head cold. You have a lot of pressure in your sinuses, a lot of snot coming out of your nose. And a lot of times these can progress into bronchitis or a lower respiratory tract infection because you get that postnasal drip. It can drip down into the lower respiratory tract. Some other conditions that have to do with breathing, your ability to breathe. Apnea. Anyone remember what pnea means? The suffix pnea.
Away.
Breathing, flow.
Away.
You're thinking. Oh wait, what? A does.
Away
It means without.
Away or without. Away is absolutely right, but it doesn't really fit here. Without fits better. Without breathing. Apnea. Without breathing. So we talked about sleep apnea. We mentioned sleep apnea when you stop breathing in your sleep. If somebody stops breathing from some other reason, you would describe them as apneic. They're not breathing. Bradypnea. What's Brady? Slow breathing rate. Dyspnea. Painful or abnormal breathing. Orthopnea. Anyone know that one? No, that you're thinking oro, but ortho, that's close, but not quite. Ortho bones, yeah, orthopedics is referring to the bones, but ortho actually means straight or upright, which is why orthopedics is actually, the study of the bones is really the study of being straight, because your bones make you straight. Ortho means straight. So orthopnea is someone who needs to be upright in order to breathe. Sometimes people who have breathing issues, they can't breathe laying down, they have to be propped up, like when they sleep, in order to breathe. Tachypnea is fast breathing. Tachy is the opposite of Brady. And there's a couple of types of tachypnea. There's hyperpnea, which is can be healthy fast breathing. So you are climbing stairs and you're kind of out of breath. Okay? In that case, that's an adaptive, that's your body adapting to your higher metabolic needs because you're exercising, so you do need to breathe faster. But if you have a heart condition or something, you may be experiencing that shortness of breath, as they call it, hyperpnea. for no reason. So sometimes hyperpnea is not a good thing. Hyperventilation is different. It's moving air, but it's not proper breathing. So in hyperventilation, I always have to check myself here. You are breathing out too much, but you're not breathing in properly. So you're having shallow breaths in, but full breaths out. And so then you end up losing too much carbon dioxide, which can turn your blood kind of basic, which is why you get kind of lightheaded when somebody's hyperventilating, and also why you're supposed to breathe into a paper bag, because then you're breathing out the carbon dioxide and then you're breathing it back in. So you're breathing in more carbon dioxide, because the problem is that you're breathing out too much because you're not ventilating properly. You're having shallow intakes and deep out breaths. So usually it's from stress. A panic attack will cause hyperventilation, so you have to calm yourself down and also restore carbon dioxide levels. Some other conditions, now for some conditions that affect the lungs. Adult respiratory distress syndrome and infant respiratory distress syndrome are similar in that what happens in respiratory distress is that the alveoli, those air sacs, collapse. So when you breathe, your alveoli close, and then when you breathe in, they open. And you breathe out, they close. When you breathe in, they open. So the problem happens if they close and then don't open back up again. And in infants, this usually happens because infants, in order to be able to open back up, your lungs need this chemical called surfactant. It's like soap, and it just makes them more slippery and easy to open back up once they're closed. Premature babies, a lot of times, have not produced enough surfactant in their lungs, and so they suffer from breathing problems called infant respiratory distress syndrome. Now, with medical technology, there's a lot of treatments for this. In fact, there's inhalers that will give, babies can breathe in surfactant, so it makes their breathing a lot easier. So, in fact, a lot of improvements in like neonatal care have come in the form of helping infants who have this condition. So it's not as big of a complication as it once was. Adult respiratory distress syndrome is usually caused by trauma or by inhaling some kind of toxic chemical that damages the alveoli and causes them to collapse. Atelectasis, that's how you pronounce it. For a long time, I was pronouncing it atelectasis, and then I was watching Grey's Anatomy one night, and Dr. Bailey was telling someone that they had atelectasis, and I'm like, ha, you pronounced it wrong. And then I was like, wait a second. They have like medical advisors on this show. They probably wouldn't let a character pronounce a medical word wrong. I'm probably doing it wrong. So I looked it up, and I was doing it wrong. So I learned something from Grey's Anatomy. Atelectasis, proper pronunciation there. It literally means incomplete dilation, but it's basically the medical term for a collapsed lung. The layman's term for atelectasis is a collapsed lung. So part of the lung has several alveoli that are collapsed shut and not opening back up. Some other conditions of the lungs. COPD, chronic obstructive pulmonary disease. So that would be a acronym you should know because it's in my PowerPoint. It's mainly caused by smoking, chronic smoking. So here's, healthy lungs on cigarettes. So it also shows the heart here too. So you can see healthy lungs are nice and pink. They're shaped like the textbook version. Whereas after smoking chronically, well, first of all, these lungs are black from tar deposits from the cigarettes. But also you can see the shape of them is different. The apex is broadened. And people who have COPD are often described as being barrel-chested, sort of square-chested, because their lungs are actually sort of enlarged because of having to try to work harder to breathe. Also, the heart is enlarged. You get cardiomegaly in COPD because, again, they're not getting a lot of oxygen. Their blood is not well oxygenated. And so their heart has to pump harder to try to get the little oxygen they have to all their different tissues. And so since the heart's a muscle, when it works harder, it gets bigger. So COPD is a combination of bronchitis and emphysema. So common in smoking. Lung cancer also can be caused by smoking. Again, the example here is a clean piece of lung, and then this lung tissue right here has a nice big white tumor in it, but you can also see a lot of black spots from tar deposits indicating that this is from a smoker's lung. There's also occupational lung diseases from breathing in dust that can cause chronic lung inflammation or even to certain types of lung cancer. So we call these conditions the term for a lung disease that's caused by breathing in harmful dust is pneumoconiosis, a condition of the lungs, pneumo. Conio means dust. Okay, so some examples are asbestosis, people who work in the asbestos industry, breathing in asbestos dust, which is like little fine glass pieces that stick in the lungs and can cause a form of cancer called mesothelioma. You've seen, there's like a lot of legal ads on TV now for if you know someone who developed mesothelioma, like call us, we'll help you sue their employer. Anthracosis is the medical term for coal miner's lung, from breathing in coal dust, okay, which can cause chronic inflammation. I had a student once who worked with horses, and from working with hay for like her whole life, breathing in hay caused different, like breathing conditions. So any type of occupation where you're regularly breathing in dust, wear some kind of a mask. Cystic fibrosis, sometimes called CF, is a genetic condition that people are born with, and it's actually a condition where the body produces too much mucus. All of the mucus-producing cells in the body make too much mucus. So it affects a lot of different organs, but the thing that usually is fatal is too much mucus secretion in the respiratory system that eventually basically causes like drowning from mucus, so much mucus in the lungs. So there are various, some treatments to help prolong the lives of people who have cystic fibrosis, but still their life expectancy is really low. I think now it might be close to 40. It used to be more like in the 20s. So it is still a fatal terminal condition. This is like an older picture. It looks like from like the haircuts and stuff that it's probably like from the 70s or 80s. But this technique is still used. It's called chest percussion, where they lay at an incline and somebody literally just helps beat on their chest to move that mucus up and out of the respiratory system. So one thing that is so some of these infections are common in people with cystic fibrosis, empyema or pyothorax, excessive pus in the lungs. So having all that extra mucus there means that bacteria and stuff can get stuck in it and they can start growing. And so they're more prone to getting different lung infections because they have all that mucus that doesn't move out as much as it should. So this is a place for you to learn this new combining form, pyo, which means pus, which is in both of these words, empyema and pyothorax. Some other types of, so some of these lung infections can be caused by a variety of different microorganisms. I think that the section in the book that talks about this is a little bit more detailed. So again, focus on the detail I have in this slide here. Influenza is a virus, the flu virus. You get your flu shot to protect you from influenza, a respiratory virus that happens to mutate very quickly, which is why there's a different flu shot every year. Legionnaire's disease is a bacterial infection. It's actually an eponym. It's named after the American Legion because it first occurred in a hotel where there was an American Legion convention, which is like veterans convention, and a bunch of them got sick, and this new pathogen was identified, so they called it Legionella, and it causes Legionnaire's disease. Tuberculosis. Saranac Lake has a lot of tuberculosis in its history. It was sort of founded as a tuberculosis treatment resort. It's often referred to as TB. You don't probably know a lot of people who have ever had tuberculosis because in developed countries we've largely really reduced the numbers of tuberculosis, but it's still like one of the top 3 infections, killer infections. Malaria, tuberculosis, and HIV are the 3 biggest pathogen killers globally. So tuberculosis is still a big global problem. Pneumonia is a serious infection of the lungs. Okay, it can be caused by a bacteria or it can be caused by a virus. There's double pneumonia, single pneumonia, walking pneumonia. The book talks about all these different types of pneumonia. You don't need to know that for the test. I'm not going to ask you the difference between them. But you should know that it's an infection of the lungs that can be caused by either a bacteria or a virus. pulmonary embolism. This is an embolism is a blockage of blood. It's like something that can block your blood. So it could be like a blood clot. An embolus can be a blood clot, or it could be like a big glob of fat, okay, cholesterol. And so an embolism is when you have a blood clot or a glob of fat that gets stuck in a blood vessel and doesn't allow blood to go through and oxygenate that organ. So a pulmonary embolism is when you have a blood clot in a pulmonary vessel. Either this large pulmonary vein, the one that leads from the heart to the lung, that's very deadly because you're blocking blood supply to like an entire lung. You can have smaller ones that are not as deadly because they might be painful, and then you may be able to diagnose it and break it up and restore lung function, but the smaller ones will block oxygen flow to parts of the lung or like a whole lobe of the lung. But this one is particularly deadly, this pulmonary embolism here. So my story about this, anyone here pregnant? No. Okay, the semester that I was pregnant, I had a student in the front of the class. She was very like to offer up a lot of stories, and she was very gregarious. And when I showed this slide with my belly like this, because I was very pregnant, she's like, oh, I had a friend who died from that during labor. And I was like, why would you say this to me right now? I am pregnant. I'm about to go into labor. I don't need to know these things. So it was kind of funny, kind of like awkward, uncomfortable funny. But so very rare complication, by the way, of labor. Clotting can be a problem during labor, but that's a particularly rare complication. But it is something that is dangerous, I guess is the point there. All right, so some other conditions that don't have to do with the lung, but actually the pleural membranes and the pleural fluids surrounding the lungs in the thoracic cavity. Hemothorax, what would that be? Blood in the chest, yep. Pleural effusion is when you have too much pleural fluid in between those pleural membranes, so you have too much fluid in the chest cavity, and basically it pushes on the lungs and it makes it very hard to breathe. You can't expand and contract if you have too much fluid in there. So the treatment for that is thoracentesis. What is that? What would that mean?
Extracting the...
Exactly. Puncturing and extracting that fluid. Just like we talked about an abdominocentesis to remove ascites buildup from liver disease, thoracentesis would be to take a giant syringe, puncture the chest cavity, and remove extra pleural fluid. Pneumothorax is actually, pneumo means lung or air. So pneumothorax is when you get air in the pleural membrane, air in that space. And what happens then, it's like you basically get a collapsing of the chest cavity there. So that also affects your ability to breathe. So having air or extra fluid in the pleural cavity is not good. Has to be, like, same thing actually happens. They take a syringe and pull out the air, or just a straw, just jam it in there and let the air go out.
If somebody gets like a tension pneumothorax and their trachea like moves, is that because of the air pushing against the trachea, or is it because of
How does the
lungs?
trachea move exactly? What do you mean by that?
Like when we were doing our first aid training, the Army, they told us about like the tension pneumothorax, and like one of the last signs is like a deviation, like the whole thing will actually move.
Interesting.
Like it gets extended or something like that.
Maybe if the whole thing is being shifted, if the whole thoracic cavity is shifting. Because of the air.
Because of the air, if it's like the lungs trying to work.
I don't know. I don't know what causes that. That's a good question. I'll have to look that up. I always have like an EMT or someone who's emergency trained who gets to provide me with all these like extra tidbits. Some other sort of minor symptoms of respiratory infections. Cough. If you have a cough, that's basically your body's natural reflex to get mucus out or to get bacteria out of your body that are causing infection. So if you have a very, sometimes you might have a dry cough, but sometimes you might have a very mucusy cough, all right? So if you have a mucusy cough, that's called expectoration. Coughing up mucus is called expectoration. It literally means a process of getting stuff out of the chest. You're expectorating. You're coughing up mucus. So medications, we'll talk about medication drug categories that are helping you to like loosen up sputum so you can cough it up easier are called expectorants. Hemoptysis, which is one of your pronunciation / spelling words, is Hemoptysis, the suffix here, means to cough up. So hemoptysis is coughing up blood, which can be a sign of serious respiratory infection. Tuberculosis patients oftentimes experience hemoptysis. I used to be obsessed with the movie Moulin Rouge when I was in college, and the main character in that movie has tuberculosis. They don't say it, but she's always, occasionally in the movie, she coughs into like a little white handkerchief, and there's like little red splotches on it. So she's got hemoptysis, which is kind of like the classic sign of tuberculosis, especially in the days when it was very prominent. Some medical terms that indicate your oxygen levels. Anoxia, being without oxygen. Asphyxia, as a condition of strangulation, not being able to breathe. Cyanosis, anyone know what that is? When you turn blue, either your lips turn blue or your skin could turn blue. It's a turning blue from a lack of oxygen. Deoxygenated blood that doesn't have oxygen, appears blue through the skin. So cyanosis is a sign of low oxygen. Hypercapnia is excessive amounts of carbon dioxide. That can happen from hypoventilation. And hypoxemia is really referring to low oxygen levels in the blood at the cellular level. So your cells can become hypoxic. Like cancer cells, a lot of times cells in the middle of a tumor are said to be hypoxic. They're not getting a lot of oxygen. Okay. Some different medical and surgical procedures. CPR, cardiopulmonary resuscitation, is part of the cardiovascular system, but also part of the respiratory system. You do chest percussion to help the heart pump blood, but then you also breathe into the mouth to help restore oxygen. Endotracheal intubation, for a patient who has a blockage and they can't breathe because there's some kind of blockage in their trachea, then you would stick a tube through the trachea in order to breathe for them with like a bag or a machine, could blow air into their lungs so that you don't have to be blowing into their mouth like CPR. Spirometer is what's pictured here. It's a device to measure the strength of your breaths. So this will be done for people who have lung conditions, lung disease, and if they're recovering from lung disease to make sure that they're restoring their lung capacity. A tracheostomy is pictured here. Ostomy, a surgically created opening. So someone who has tracheal damage might need either temporarily a tracheostomy so they can breathe, or a permanently one if they have to have part of the trachea permanently removed. And then lastly, the different drug categories. So we've already said in the last chapter what antibiotics are. They treat infections. An expectorant would be something like Mucinex would be the classic one that helps you cough up mucus, okay, if you have like a thick mucousy chest cough. But if you have just a dry cough, you might take an antitussive. Tusso is a combining form that means cough. This is a drug that basically targets the cough centers in your brain that are responsible for that coughing reflex. So a lot of times, anti-cough medications, you might have an antitussive. You might have one that's an antitussive and an expectorant, so it loosens mucus and it reduces your coughing. So I like to tell people when you go to, if you have a cold, if you have a cough or a respiratory infection and you go to the store, there's like a whole aisle of cold medications. So how do you choose the right one? Look at the ingredients and see what are your symptoms and compare your symptoms to the ingredients and buy the one that's right for you. I'm always picking on my husband because he tends to, whatever his ailment is, he'll go and get like Dayquil and NyQuil or something that has like multi-symptom relief, even though all he has is a headache and a stuffy nose, but he'll get something that's got like an antitussive and an expectorant. I'm like, you don't need those things. You don't have those symptoms. So the best thing to do is treat the symptoms you have, get the right formula for the symptoms you have. And what would a bronchodilator be used for, do you think? What? Something to do with your breathing. Dilating the bronchi. It would dilate the bronchi, so who would need that?
Someone with bronchitis.
A person with asthma. Somebody who has bronchoconstriction. The smooth muscles are constricting in an asthma attack. So bronchodilators are for people with asthma, to dilate their bronchi. Yeah,
It's like an inhaler.
An inhaler is it's like inhalant bronchodilators, exactly. Or if you've ever used a nebulizer, which is like a kind of like an inhaler, but you don't take it with you. Okay, so that's the end of chapter 4. So I'll see you next week for your quiz and our first group review session.
I got my hopes up when I saw the email. And I was like, that's not us.